Hello. So today we're going to do a reflection questions. So we will discuss six question. First question is about describe the activity carried out during the modules. So Vera will be first give opinions about activities.
Hi, my name is Veera, and I will be explaining about the activity carried out, which in one of the weeks, which was a puzzle. We were given a digital puzzle to be solved in the iPad, and then once we solved the puzzle, there was a scenario, a medical situation scenario, which we have to find out and then read it out after that.
For the next one is Edison.
I'll be talking about the bingo game designed to test our understanding of ethical behavior. The game, instead of using numbers, we used scenario related to ethics. To earn the point, we have to either act it out or draw the situation correctly in front of everyone for them to guess. And they also gave a goal card which allow us to sabotage other people's team. That's all.
For the next week two, week three, whisper game. It's about passion and privacy and also confidential. So basically, it was a childhood scheme. Telephone WhatsApp. The one person will be whisper about patient related message to the next member and keep going down by the line. And by the time it will be changed, the message, some detail will be missing or some will be completely wrong. And after that, will be talk about this and relate with the real life situations in the healthcare. So next, next.
So basically, during our PEC, which is Ethics and Value module, we have a lot of variety of interactive and collaborative activities among us, which include the basic discussion, role-play scenario, and also the group reflection on the ethical dilemma on healthcare setting lah. So basically, we have the second session, which is on the week 4, which is also the same game, which is Whisper the Secret, like Danny said just now, which is Drive Rose Up. But then this is the other concept lah, which is on the patient privacy and confidentiality. So basically, it will stimulate the sensitive data that can be unintentionally breached. So this kita look simple but powerful exercise, but and when we emphasize, it is important of when we keep the patient data, and this risk of confidentiality breach in healthcare communication also.
And then for our group's activity, we conducted two activities. The first one was green flag and red flag, where we presented a bunch of scenarios to the audiences, and then they have to read the sentences, the scenarios, and then they have to decide whether it's a right thing to do or a wrong thing to do. If it's right, they have to raise their green flag, or if it's wrong, they have to raise their red flag.
So for the last team, group one, they had a crossword game where they have given a phrase and we have to guess the word, and the word we have to guess it precise and we have to fit in the box. It was hard but confusing, but yet we able to finish it.
And also the team also has conducted the charade as well. Everyone had turn and well participate as well. The games not only help reinforce our understanding but also encourage teamwork and also fast thinking.
Okay, so for question two, what were objective? Did you achieve the objective? So, Vera, what your opinions about these questions?
For my game was It was about doing the puzzle together. So I think it was a lot about teamwork and then also leadership at the same time, because we had to have one person to orchestrate whoever picked up what pieces and stuff, and we had to work together to find the right pieces to put in at the right spots, which was not easy. And after that, we would have to discuss and really opinionate with each other so that we can really find out what the issue was, or what the scenario was that was shown in the puzzle. And also the objectives were to really grasp the understanding for patients' autonomy and medical consent in this that one and in this game. And the puzzles, they really helped us understood whether it was our puzzle or the other team's puzzle as well. They really helped us understood the grasp and to let us grasp the main objectives, which was to really understand patients' autonomy and medical consent, which are two very important things. How about you guys? How were your games?
My game was bingo, but they had a culture value and custom of belief and social norms. They give a scenario to act it out in front for us to guess. So we have to communicate with each other, even though some of us couldn't guess and some could guess. We respect each other. I guess the objective were to encourage us to think critically, work together, and we achieve we have achieved this objective.
Yes, I agree. Uh, for my games, the goal was to show how easily it is for communication to get mixed up and how communications can be a big problems when it comes to getting like proper consent from the patients. So we supposed to make sure patients fully understand what they agree to, and this game made it clear how easily it is to miss or twist the important information without even meaning to. So, Danish, are you agree with this statement?
Yes, yes. I think so. I agree with you. So, for next, for my opinion on the objective and achievement, I think some of the objective like we have to understand the principle of the medical ethics lah. Since we on the PEC ethics and value, so I also is will develop lah the interprofessional communication and also the decision making skill lah around on the activities. So I believe we will success achieve this objective lah. I guess. What do you guys think?
I guess we actually like met all the objectives, right? And also for my game, the red flag and green flag game, the objectives were to raise awareness about the ethics in professional practice, uh, commonly in hospital areas, in medical centers, and also to encourage critical thinking about what's right and what's wrong, and also to promote interprofessional dialogues and also respect for different parties in that scenario. And yes, I'm sure we achieved all those objectives because our game actually created an engaging environment for learning, and then it encouraged participation from everyone, and also it helped us to think deeper about everyday ethical decision that we encounter in our daily lives.
Yeah, I totally agree with what Talisha said just now. So, like for Team Crossword, right? They do follow their ethical theories and also practice moral decision in that can be applied in real scenario in future. So not only that, we also practice the interprofessional collaborative to value them and to understand the role and responsibility. And in that game, particularly for the crossword puzzle, right, we really need a good communication practice and also a proper teamwork so that we can finish the game in proper time. So I do believe that we really achieved the objective.
Okay, I do agree with Pavitra and everyone's opinion here. And for week six, the group one also conduct the charade activity. So one of group member have to go in front and have to act it out based on the keyword they given. It's more to relate with the disease and medical equipment. So through this activity, it helps us to recognize the different type of disease and medical equipment in a fun and memorable way. Also, we help to enhance our non-verbal communication skills, which are vital when verbal instruction fail in clinical setting. And it also helps us to build teamwork as we rely on quick thinking and cooperation to interpret the clues. I fondly found it meaningful and reminded us that even small action, when overlooked, can lead to serious harm in patient care.
Okay, for the next questions. Do you think these activities are important to build ethic or professional skill? If so, why?
Yeah, I really do think the activities were important to build ethics and professionalism skills because we are all from different fields, like we have MBBS, pharmaco, and so on. So it is really important for us to be able to work with people of different fields because in the hospital we will be constantly contacting other departments while working. And these activities really allow us to synchronize and to expect what other people, um, how other people react to what you do, and so on. It is, and it's really important to build ethics because you can truly understand, and we get the opportunity to understand from a young age itself how the other people react and how the other people understand us, even though they are from very different fields.
Yeah, it kind of makes sense. The activity was valuable in building ethics and professionalism because it revealed how we behave under pressure and competition. Even we were given a golden card to sabotage other group or attack and defend ourselves, our group didn't use it. It shows that ethics is not only about knowing what's right, but also about how we act when faced with choices, especially when the rules can be banned for our personal gain.
For me, possibly yes also. This activity made ethic feel real and relevant instead of just like we reading a book about information about concerns in the textbook. So we saw how easily it can fall apart in practice, especially if the communication is not clear or if the patient left out of the conversation. It made me think about how we, as a future doctor, need to slow down and really talk with the patient, not just about them. So, you agree with this, Danish?
Yes, yes, I agree with you. So I think this activity are also extremely important, which is they provide a safe space to explore the real life scenario regarding on the future in hospital lah. So by working in interprofessional teams, so we gain insight into how we different healthcare professional will perceive and also address the ethical issues. So this will promote the mutual respect among us and then understanding and also the collective responsibility. So this the most important component lah for our professionalism on the healthcare providing. So how about you, Talisha?
For my game, the red flag and green flag game, in my opinion, it was important to build ethics and also professionalism skills because that activity actually was interactive and also reflective, and it made the audiences to learn to have the experiences and to become more memorable. Also, for the scenarios, sometimes we assume that it was right, turns out it was wrong, and sometimes we assume it was wrong but turn out it was right, so we should know what we will do when it happens in real life when we encounter such situations. How about you, Pavitra?
Okay, I think from all the activities that we have conducted, we have participated in our PEC class. Throughout the PEC class, I think it's very important to build the ethics and professionalism skills. Why? Because like with this game, we can learn from mistakes so that we do not repeat it in future. Yeah, Shweta, what about you?
Okay, well, from my opinion, all these activities help us to develop important soft skills like teamwork, empathy, decision making, and communication. It also helps us to apply the ethical concept in realistic scenarios, like strengthen our understanding and prepare us for future clinical settings.
Okay, so for the next questions, what did you learn from this activity with regard and to ethic and professionalism? So, Vera.
In regard to ethic and professionalism, um, I learned a lot because mine is about medical consent and um, patient autonomy. Patient autonomy refers to the right of the patient to make informed decisions about their own healthcare. And it respects the individual's ability to decide what happens to their body. So that's very important as a doctor. We have to respect and that boundary that we were set. That is um, the majority of our job lah. And then also taking consent. Consent is very important both in the legal terms and the ethical terms as well. Like we learned a lot because we also went through the bad things, the dark side of what happens if you don't follow these rules and you don't take consent and you don't respect patient autonomy. They gave us a few scenarios about it, and it is not pretty legally and ethically as well, and that is very important in our line of work.
From the activity I played, bingo wasn't a lot to be learned, but I learned that professional includes fair play, respect others, since it includes cultures and self control. Even when given a chance to sabotage other team, it was important to reflect whether it's aligned with our values that we are learning.
For me, what did I learn from the activities about patient consent? So I learned that getting patient consent is more than just a formality. It's not about formality, it's about the respect we ask to the patients. So patients have the right thing to know what exactly what is going to happen to them, and they have right to say no as a future professional. We have to make sure they well informed and not pleasure, and always give a choice to them. So Danish. Danish.
So on the discussion, so I learned that the ethics is not just about knowing the what is right or any right, like what is wrong, but it's about how we apply the principle, like for example, like the autonomy, the beneficence, non-maleficence, and also the justice in the complex scenario. So I also learned that there's important of maintaining the patient confidentiality and being honest and also transparent in communication. So it shows us that we are respecting the culture and also the individual values lah. So how about you, Tanisha?
Through the red flag, green flag game, I learned that ethical behavior can be sometimes subjective, and also it's important to consider different perspective because of the people that will be involved in the dilemma. And also, I realized the importance of open dialogue the importance of discussing things in solving ethical dilemmas, and also how professional values such as respect, honesty, and accountability, and also responsibility play an important role in team-based scenarios and also team-based problems.
What I learned from all the activities that we have conducted and participated regarding the ethics and professionalism is the communication. Communication is the key for everything. So, in my opinion, we should start practicing and building the fundamental of ethics and professionalism from now onwards. And we have to prioritize the ethical, all the basic activities that from all the basic activities that we have participated from our class.
Well, overall, we all learn the importance of respecting patients' cultural backgrounds, ensuring the rights to autonomy, protecting confidentiality, and prioritizing patient safety. And also, professionalism also include how we interact with peers and other healthcare students, like with MBBS, pharmacy, BPM, also BCT. So, which was reinforced through these activities as well.
Okay, for the question 5, what your contribution in these activities and are they enough?
I believe I contributed enough in all of the activities that we did, especially the puzzle game because the puzzles were quite hard to do, and it it's difficult having 7 people doing one puzzle. So I felt like I did well because I divided everyone to take one part of the puzzle to do. So like I put Adamson to the top right corner, I put Pavitra to the left corner, and then they work their way down from there. I feel like did that was a good contribution for me, and as well as figuring out the situations that we were given because that um, I answered a few questions myself, and I feel like I did contribute enough in that game. Thank you. How about you, Adam, in your game?
Yeah, I also feel like I have contributed enough because we participate actively. Even during the bingo game, we have to go in front and act. Vira and I went in front and act like an cow, if you guys remember. Yeah, and we didn't really argue or disagree with the others. We did our best, and I guess my contribution was enough. What about?
So for my part, I'm sure I'm actively participate in our group discussion, and also we are sharing opinion during the ethical debates and during discussion on the scenarios and so on. And I believe that my contribution meaningful to our groups, which is always room for improvement lah. So I could have engaged more deeply by volunteering for leadership group lah within the group actually. So yeah.
Okay, for me, I think I took part in the game and shared during the discussion. Point out how in the real life situation in the hospital setting and about the concern can be sometimes be rushing or closing over, especially when the doctor are really busy. So I also mentioned how we should double check if the patient truly understand, especially if there are language barrier or if they are seen unsure. I think I think I already contribute well in this game, and yeah. Uh, how about you, Victor?
So from my opinion, my contribution is enough too. So if you all see from our group activity, we have two games, right? So one of the game was green light and red light. So for that, Adamson, Talisha, and I was teamed up, and we executed the game very well, I think. So yeah, for me, my contribution is also enough.
Yeah, actually, we designed the scenarios and also we made the green flag and red flag on our own. And also during the activity, we presented the scenarios and also helped with the discussion. And we had to call each one of the students to explain their reasoning, like why they chose the specific answer. And also, I also participated in reflecting the scenarios myself. So I guess my contributions were also enough for the game. How about Shweta?
Well, I hope and I guess I well contributed in all the activities. I do communicated with you all to share the ideas and help prepare with our activities as well. And also I had the chance to participate our the last week activity, which is charade, which is go in front and act it out. Additionally, I also able to interact with you all, and most of you all are MBBS and Talisha is BBM, right? And also able to communicate with Pavitra, and which gave me a broader perspective on teamwork and professionalism in a multidisciplinary setting. I also believe my contribution were meaningful, though there's always room to be more proactive.
Okay, for the last questions, when and how will you use this skill and that you learn in the future?
Um, I believe that this was a fun way for us to hone our skills, and it is likely that we will explore complex real world scenarios like the puzzle that we faced. It was complex, but this one will be in the real world scenario, and we explored all of that in a safe way. But in the future, it won't be so safe. That's why we have to expose ourselves right now so that we can be experienced enough for the future. It also improved our ability to apply ethical reasoning, spot consent issues, and collaborate with other peers at the same time. And these skills are very directly transferable to the clinical setting in the future. And to add on, it helps in our line of work again, as I would say, because as a doctor, we will encounter patients with diverse beliefs, values, and preferences. For example, a patient may refuse a blood transfusion for religious reasons, and our role is to respect that choice, even if it challenges your clinical judgment. So, skills like that we learn during this activity itself. How about you, Adam?
I guess in the future, I'll use this skill in group projects, internship, and like you said, in workplace situation, whether it's staying fair in competition, respect other teammates, or making decision and handling conflicts ethically. This value will guide my behavior and my decision making.
For me, I will apply this patient consent. So in the future, like I will make sure to explain procedure or anything in clearly and check that patient truly understand and always respect their choices. So I will take this time to get the real information consent. So not just a signature.
So from my point of view, so I will apply this skill throughout my clinical practice, which is next year we'll go into the clinical year. So for example, I will ensure the patient information is shared only with the authorized individual and also always with consent lah. So in ethically, which is in a complex situation, I will strive to communicate clearly, seek guidance when needed, and make decisions that respect patient values and also the professional standard. So these skills are essential not only in direct patient care, but also in teamwork, leadership, and also the patient advocacy role. So I think yeah. How about you, Talisha?
For me, in the future, especially in interprofessional teams, like when I work in a medical setting or in laboratories, I would use these skills to solve ethical dilemmas with more confidence. Because during that time, I think I will know what to do exactly and like how to solve the problem. Also, if not, I will help indirectly by advising my co-workers or colleagues. And also, I would also encourage inclusive discussions where we include everyone, our co-workers, our teammates, or our colleagues into the discussions, and also respect people's opinions, and also apply ethical decision-making process in clinical settings or workplace to ensure fairness and also professionalism.
Okay, to keep it simple, I can start practicing all these from now onwards as I'm a part-time worker, and to how to say, to to keep the to keep the dilemmas, like ethical dilemmas, better, and how I can approach a situation properly.
Well, for me, I plan to use these skills during my clinical practice, especially when dealing with patients from diverse backgrounds. I will apply principles of ethical decision making, respect for autonomy, and maintain professionalism in communication with both patient and colleagues.
So I think that's all, and all 6 questions has been answered. So do you guys agree with any opinion want to add or no?
Yeah, this was a very productive conversation that we had with each other. I'm glad we had this conversation in this meeting that we had.
Yes, I agree with that. So I think this is going to be end of our discussion, reflections. So thank you.
Alright, thank you guys.
Thank you.
Thank you, guys.